Welcome to this explainer. Okay, today we're exploring a medical breakthrough that honestly sounds like it was ripped straight out of a sci-fi movie. We're diving into the rapidly evolving world of medical microrobotics, and specifically, we're looking at a brand new invention designed to tackle one of the absolute most agonizing conditions known to humanity.
So what if we could treat kidney stones entirely without surgery? Listen, if you or someone you know has ever had a kidney stone, just the mere mention of it is probably making you wince right now. The pain is frequently described as excruciating, often compared to childbirth. But what if that immense pain could be eliminated? And not by a scalpel, not by a laser, but by a tiny, tetherless robot navigating through your body to gently melt the stone away. Well, it's a very real, upcoming medical possibility that could literally change millions of lives.
To really get why this is such a massive deal, we've got to grasp the sheer scale of the problem. Kidney stones affect roughly 12% of the global population at some point in their lives. Think about that. And if you get one, there's a 50% chance you'll get another within 5 years. We're talking about millions of emergency room visits, lost productivity, and billions of dollars in healthcare costs annually in countries like Canada and the US alone.
Okay, let's dive into this. Here is our path for today. First, the kidney stone problem. Second, flaws in current treatments. Third, we'll meet the micro-robot itself. Fourth, exactly how it melts stones. Fifth, the lab results and validation. And finally, the future outlook.
Starting off with Section 1, the kidney stone problem, an agonizing reality. So, kidney stones form when minerals and salts in your urine literally crystallize into solid masses. They can be as tiny as a grain of sand, or they can grow to several centimeters, causing internal bleeding, nausea, and severe blockages as they travel through the urinary tract. But not all stones are created equal. While calcium oxalate stones make up about 80% of cases, today we're specifically zeroing in on uric acid stones, which account for about 10%. This new robotic tech is targeted right at these stubborn stones, which typically form in highly acidic urine.
Moving right along to Section 2, flaws in current treatments, or what I like to call the painful status quo.
The thing is, uric acid stones respond terribly to conventional approaches, and that leaves patients in prolonged discomfort. Our current medical arsenal basically relies on a bunch of painful trade-offs. You've got oral medications that try to change the acidity of your urine, but those take weeks or even months and can cause severe gastrointestinal side effects. You've got shockwave therapy blasting the stone from the outside, but it really struggles with large stones, and you still have to painfully pass the fragments. Then there's invasive ureteroscopy, which requires anesthesia and often leaves you with a highly uncomfortable stent. And for the biggest stones, surgeons literally have to cut into your back directly to the kidney, which means hospital stays and long recoveries.
So this builds a really clear case for innovation. On one hand, current treatments are invasive, they carry systemic side effects, and they demand a long downtime. But on the other hand, we have the promise of tetherless microrobots, completely non-invasive, highly localized treatment with zero systemic side effects, and the very real potential for this to become a simple outpatient procedure. It's a night and day difference for patient care.
Which brings us to Section 3, Meet the Magnetic Micro-Robot, our sci-fi protagonist.
Developed by a brilliant interdisciplinary team of researchers at the University of Waterloo up in Canada, the absolute first thing to know is what this robot is actually made of. It's not rigid metal and gears. No, it's crafted from gel MA hydrogel. This is a biocompatible, soft, and totally flexible matrix material. This is crucial because it means the robot won't scrape or traumatize the delicate tissues of your urinary tract. And buried inside this soft hydrogel are tiny micromagnets, along with an enzyme called urease.
And this brilliantly illustrates the scale we're talking about here. The robot is approximately 1 centimeter long and 1 millimeter thick. That is essentially the exact size and shape of a single grain of rice. The engineering required to pack magnetic locomotion and chemical payloads into a spec this small is just breathtaking.
But you're probably wondering, how does a grain of rice actually swim upstream inside a human body? Well, the Waterloo team designed two really distinct variations. The fin-like configuration uses a paddling motion to squeeze through the incredibly narrow, confined spaces of the ureter. Meanwhile, the screw-like configuration uses rotational propulsion for stability in wider areas like the kidney's renal pelvis. And here's the kicker: there are 0 wires. Doctors steer these robots entirely from the outside using a motorized, rotating magnet on a robotic arm, and they track the robot in real time using standard clinical Doppler ultrasound.
Next up is Section 4, How the Robot Melts Stones by Flipping the Chemistry.
Instead of bringing tiny jackhammers to mechanically break the stone apart, this robot relies on a super elegant chemical reaction. The process is beautifully simple when you break it down into these 4 steps. Once it's navigated to the stone, the robot's hydrogel matrix allows that embedded urease enzyme to interact with the urine. This enzyme acts as a catalyst, instantly breaking down the natural urea in your urine into ammonia. This completely flips the local environment, rapidly raising the pH from acidic to alkaline. And because uric acid stones literally cannot survive in an alkaline environment, the stone just begins to melt away. It's exactly like an ice cube dissolving in a glass of warm water. It is targeted chemistry at its absolute finest.
All right, on to Section 5, lab results and validation, because we need to prove the concept.
Now, what's really interesting here is that theory is one thing, but actual proof is another. The team tested this using real human uric acid kidney stones in an environment perfectly mimicking human urine. And the sheer speed of the results is wild. Over just 5 days, the control group, without the robot, saw a standard 15% reduction in stone mass. But the group treated with the enzyme-loaded robot saw a massive 30% reduction. It literally doubled the dissolution rate by creating a sustained, localized alkaline zone. And it did it all without having to pump the patient full of systemic medications.
And the successes definitely didn't stop there. The hydrogel naturally swells, but the team proved it actually maintains its structural integrity and its enzyme activity for over 65 days. That is way longer than a typical treatment would ever require. Plus, they proved its mobility by successfully navigating it through a life-size 3D-printed human urinary tract based on actual CT scans, reaching impressive speeds of 5 millimeters per second. It's fast, it's incredibly durable, and most importantly, it works. Finally, Section 6, the future outlook and what's actually next for medical microrobotics.
Now, as with all cutting-edge tech, we have to be realistic and look at the whole picture. There are absolutely remaining challenges. We still need to see how the robot handles the chaotic fluid flow of real human anatomy. And remember, it currently only treats uric acid stones, not the calcium ones. Plus, regulatory approval from bodies like the FDA or Health Canada is going to take years of clinical trials. However, the next steps are incredibly promising. The Waterloo team is moving toward large animal studies, optimizing those control systems, and they're even exploring if these robots could deliver other drug payloads for totally different diseases.
It's just an incredible convergence of engineering and urology, born right in Canada, offering a true glimpse into a much gentler, faster future. The idea that we can soon deliver monumental medical relief at the scale of a single grain of rice is astonishing. It really begs the question, if we can melt kidney stones with remote-controlled hydrogel, what other excruciating conditions will soon be cured by a robot no bigger than a grain of rice? Thank you so much for joining me to break down this remarkable breakthrough. For more, visit our website, Fair's Solution.